102.9 DRCFM. Good morning. I'm Kim Zachary, and joining me once again, Miles Everett, coordinator of Bristol Hospital's Diabetes Center. Good morning, Miles.
Good morning.
I am disturbed to find out that diabetes is really at epidemic proportions now. Is this true? 26 million Americans?
Pre-diabetes, they believe is at like 79 million. So there's a whole huge tsunami of diabetes coming in this country.
Let me ask you first off, what is diabetes type 2 and why is it so common now?
It's a vascular disease. Our bodies run on blood sugar. That's our energy fuel. If there's a problem with our insulin, the sugar can't get into the cell, and so the cell can't run. And when that happens, then the blood sugar levels go to toxic levels in the bloodstream, and it begins to break down your circulatory system. And usually the first thing that goes wrong is a heart attack or a stroke. It could also lead to blindness, amputations, kidney failure, dementia. It goes on and on and on. It's a systemic disease.
That's really scary, but it can be prevented.
It can be prevented. And one of the big issues, why it's really so prevalent now, is we're bigger and we don't move. The obesity epidemic has come and everybody's gotten very sedentary. And those are the two things you want to go after. If you lost as little as 10 or 15 pounds, that can make a huge difference to your blood sugar.
It's like smoking. You hear that as soon as you stop smoking, your lungs start repairing themselves.
Absolutely. Moving is the same thing, too. You know, we go from our chairs at the desk to our cars to in front of the television set, and we're not moving nearly as our body is meant to.
But it's not that hard to do something about that. I mean, we hear about taking the stairs and parking a little bit farther away from, the store when we use our cars. What else can we do?
The big thing I think that really makes a big difference there is to find some block of time, like 30 minutes a day, where you can do something continuous, whether it's walking or biking or swimming or dancing, but something that's continuous. And that makes a huge difference right there.
It seems like we should know all this by now, but we just can't get it through our heads.
In the 90s, they were saying 5 alive, 3 fruits a day, 2 vegetables. New recommendations are like 9 to 11 servings a day of fruits and vegetables. You can't get enough. White flour or white rice or regular pasta, switch those up to whole grain. That makes a huge difference right there, too. And you won't be eating as much. The fiber will fill you up.
Oh, Miles, thank you very much.
Thanks to you.
Miles Everett, coordinator of Bristol Hospital's Diabetes Center. The phone number there, 860-940-6300. You can always go online, too, to bristolhospital.org. I'm Kim Zachary. You're listening to 102.9 DRCFM.